Bit out of puff, aren't you?
I am, yeah.
Why are you here?
Yeah. About a fortnight ago, had a bug, bad, sweating. My chest has just got slowly worse and worse and worse. And last night I just more or less sat up all night just coughing.
Right.
Breathing's difficult as well. I'm trying to cough to get some up, nothing's coming up. But I can feel it rattling. Excuse.
Okay, have you got any history of any breathing problems?
No, never.
Okay, do you smoke at all?
No.
Have you ever smoked?
Yes. 12 years ago.
You gave up 12 years ago?
Yeah.
How long did you smoke for?
Since I was about 15, 16.
Have you noticed yourself wheezing at all?
Yeah, I am wheezing.
And how many did you used to smoke a day at the most?
30 to 50.
30 to 50
Yeah, when I
a
was
day?
smoking, yeah.
How do you find enough time in the day to smoke 50
I used to work
cigarettes?
on the markets, so you get there at
Just
6 o'clock in the
constant
morning.
chain. Fair play for giving up then, well done.
Yeah.
What made you give up?
Grandson coughed watching Thomas the Tank Engine in front of me and had a fag in my hand, and I said, that's it, finished.
He coughed in front of you from you smoking?
Yeah, and I stopped.
Right, so we have this thing that we call pack years. So we work out your smoking history based on the number of pack years of smoking.
Yeah.
So the calculation is based on 20 cigarettes a day. So if you smoke for 10 years and you smoke 20 a day, that's 10 pack years.
Yeah.
Okay, so let's average at 40. So you've got 68 pack years of smoking.
Not proud.
That is very significant
I know.
smoking history.
Yeah.
So anybody who's smoked for a long time has a significant risk of something called COPD, chronic obstructive pulmonary disease. So it's basically where you've got permanent damage to your lungs.
Yeah.
It makes you a lot more susceptible to chest infections and things like that. So pop your finger in there for me. Let's check you over now anyway. You look quite well, so hopefully
Yeah, I feel
it's
well.
not anything sort of like pneumonia or anything, but I'm going to have a listen to your chest. Right, have a stand up for me. Right, can we lift your T-shirt right up? Right, nice deep breath. So we're listening at the back. Try and touch your elbows together in front of you. Okay, so you've got some crackles lower down on this right-hand side.
Yeah.
I think you've definitely got a bit of a chest infection.
Yeah.
It would be wise if we give you some antibiotics.
Yeah.
And then once that's clear, you need to come back and have a review of your breathing again.
Yeah.
And if you're feeling worse at any point, rather than getting better, make sure you come and see us again.
OK, thank you very much.
OK. I'm sorry about the wait. Please
No,
have a
it's okay.
seat.
No, it's okay.
So what's the problem?
I've got they're like contraction pains I'm getting.
OK.
They're just like lower down.
Lower down.
I'm getting shooting pains in my vagina. And yesterday there was, do you know, in my back passage, there was severe pain there. Do you know, like now when I'm sitting down, I've got on and off coming pains.
OK. How many weeks are you now?
I'm 17 weeks and 6 days. But I went into early labour with Malika originally.
How early did you go in?
I went in 18 weeks and then she had a heart problem. And then I went on to like steroid drip. So I went in quite a few times.
OK.
Yeah.
OK, so you're worried about that?
Yeah.
OK, and which number pregnancy is this yours?
It's fifth.
OK,
It's
are you
just
weeing OK? No burning,
the weeing's
stinging,
okay.
or no blood or anything that
No,
you've
nothing like
noticed
that,
or
no.
anything? OK, and this pain, when did it start?
It's been, I had a car accident, and at that point they did start, and then they've settled. And then since yesterday, they're just getting worse again.
It's just
but
getting-
it's like in my back passage, I've not had it. But then since
Does it
yesterday,
feel as if, like, you know, there's a pressure?
it's a pressure, that's what it is, and even now, it's not easy enough.
OK, let's have a look.
It's there, yeah. Yeah.
Do you want to just lie down? Let's have a feel. OK. Can you just lift your top
Yeah.
for me? OK. Just relax, OK?
It's just there.
Tender one.
Yeah.
Is that quite tender, isn't it?
Yeah.
It's a bit difficult to sort of say what is causing it, especially with your background history of sort of you're nearly the same time that you went into labour with your daughter, and obviously your tummy's soft at the moment.
Yeah.
You are tender, but you're tender in the lower part,
Yeah.
like where the uterus is. Now, Obviously, that can be due to various reasons. I think the best option would be for you to be checked out in the maternity assessment unit. They could put the machine on and have a listen to the baby's heartbeat as well. How does that sound to you now?
Yeah, that's fine, yeah.
Let me see if I can ring them up. Hi, my name is Dr. Huck. I've got a lady who's 17 weeks pregnant. Basically, she's got a history of having a premature labour at about 18 weeks with the first child. It's a 2-day history of lower abdominal pain, which has just worsened overnight, and it feels like she describes them like strong contractions, and she's having some pain in her back passage, like a pressure. I just felt that if you could have a look at her. She went into labour at about 18 weeks?
Yeah, I'm 18 weeks tomorrow. Yeah. I had to have steroid drips with...
Sorry, she went into premature labour at 18 weeks and then she was having steroid injections. When was the baby born?
I delivered her at 37 weeks then.
She delivered at 37 weeks?
Yeah.
Yeah, okay then. Thank you so much. Thanks, bye. Yeah, they'll see you on the maternity. They said that once you've had the scan, you can go straight to her.
That's fine.
Anything in between changes, like, pain gets any worse, then you'll have to go straight away to the hospital.
No, that's
Take
fine.
your book with you.
No, but that's fine. Thank you so much. Thank you.
You're welcome.
Come on in, Have a couple of seats. Hiya.
I won't take that seat.
You can if you want. We can switch around. Right. What's going on?
I have a lump here that I'm advised to have it looked at.
OK.
Sometimes it itches like flipping crazy.
Does it?
Yeah.
And how long have you had it for, would you say?
I'd like to blame Brexit, but I've had it about 10, 15 years, something like that.
Yeah, it has grown a little.
So
Started as what I thought was a spot, and then it just developed into this lump.
Does it ever bleed?
On one occasion it has bled, yeah. That could be when I was trying to get rid of it by rubbing it a bit and washing it extra. And
Right, OK, but it doesn't bleed by itself?
No.
No, OK. And have you tried to squeeze it and get rid of it and things, or some people are tempted to poke and prod and
not
get
particularly.
the Stanley knife out and things like that? But no, you're not doing that? No, good.
No, the Stanley knife, no.
Excellent. And have you ever had any skin problems like this in the past?
I have had a cyst removed from my chest, actually, which...
Oh, did you?
I had that removed because of the smell. The smell permeated.
I know,
and it was a
they're not much
terrible
fun, aren't they?
smell.
I
And
know.
I watched him dig it out, and it was a yellow pus, and it was terrible.
They're not much. They're not nice to have those, are they? Would it be all right to have a closer look and a gentle examination and things? Right. I'm just going to put a bit of this jelly on. You don't mind if I just...
No,
come
help
over
yourself.
here? You don't mind? Is it sore to touch?
No.
Right, and this is just a magnifier with a little bit of jelly, which gives us a better idea. OK, thank you very much. Your doctor was concerned it might be a type of skin cancer. I don't think it is. I think it's an overgrowth of one of the layers of the skin, like a type of mole, if you like.
Right.
We've had it a very long time, and it's very, very slow growing, and skin cancers tend to grow a little bit more quickly, but I don't think it is when you look at it down the microscope. And I don't think we would be able to remove this on the NHS, unfortunately, because it would be deemed cosmetic. But if you did want it removed, I think there are options within the private sector.
Not at the moment, no. I'll put up with the itching.
Why does it get itchy? Sometimes it can just get a little bit inflamed. Some of the cells that are in there can get inflamed. And once we get an itchy patch, we often scratch it without knowing, and then that makes it a bit more itchy and things. So sometimes a little bit of moisturiser, if it gets a bit itchy, might just settle it down. Is that all right?
That's fine, yeah. Fine.
Great. We'll leave you to it then. Thanks for coming in.
Right.
All right. Have a
Thanks
good day.
for watching.
All right. See you later.
Bye.
OK, bye-bye. Obviously, if things do
Bye.
change in the future, please do get checked
Yes, I
out,
will
because
do.
things can change. But here and now, I'm not worried.
OK, thanks
All right.
very much.
See you later. Bye-bye.
Hello, good morning.
Hello, Mohammed.
How are you?
What can we do for you today?
Well, basically, I need some balm cream for my leg.
And what's the cause of that?
I fell and scraped my leg on a door.
Right.
And it flared up and everything, you know.
Okay,
I mean, that's 2011.
So quite a long time ago.
Yeah. It's still there, the marking, because
Yeah.
when I'm walking, especially when I'm doing a bit of exercise, the blood's flowing,
Yeah.
then it gets really itchy. I mean, as you can see, the skin gets
Yeah,
really
yeah.
dry.
Yeah.
And it starts flaking off.
And has that colour and appearance changed over the last few weeks, few days?
No,
No, fine. Have we tried any steroid cream on that?
no, I don't believe we have.
Why don't we try that?
What will that do? Will that help the itches?
Steroid creams reduce inflammation. So when things are irritated,
Right, okay.
then it kind of calms them down. So I'm hoping that that's going to improve the itching.
The other thing, right, any chance of getting a full MOT done on myself?
So you're 51. Have you had... anyone over 40 is entitled to a one-off NHS health check MOT.
No.
Have you had it?
No.
So you can book in for that?
Do I need to book it?
Yeah, but just use the words health check, NHS health check.
Right.
And then what they do is they check your blood pressure, cholesterol, height, weight, give you a kind of once-over.
Right, that's fine then.
Unless there was a particular concern that you had, you just...
I mean, to be honest with you...
general MOT, but...
Yeah, I mean, to be honest with you, I do get some pains in my chest now and again.
Really?
Yeah.
Oh, you should tell me about that. Don't just have an MOT. No, you should share that with me, please. Tell me.
It's just sometimes it's difficult to breathe, you know, on the left side. When I'm breathing, you know, it's painful.
It just catches you?
Yeah, it just
when you're
catches me
breathing.
now and again, yeah.
What about if you're really pushing yourself physically, rushing around?
I haven't really had much of that, to be honest
good.
with you. I don't get pain. It's like, you know, you get a stitch.
Oh, okay.
Yeah, it's that type of thing, you know what I mean?
Okay.
And when I'm breathing, you know what I mean?
Right.
It's quite painful to breathe.
And how long has that been the case for?
About a couple of months now, really.
Do you smoke?
I do smoke, yes.
Okay, all right. So do you have a kind of chronic phlegm, cough, or...?
Just normal white phlegm.
Right, okay. Yeah, it doesn't sound like angina or heart pain.
Right.
It could be a bit of lung pain, or it could be a little bit of muscular pain.
Right.
I don't think the MOT is going to help that. But book in anyway.
Yeah.
Because they check you for diabetes, they check your cholesterol, check your blood pressure.
Yeah, I mean, my mother's diabetic and so is my father.
Yeah, and you're a man and you're 50-ish.
Yeah.
And you're Asian. All of these things put you at higher risk of having heart disease. I mean, obviously the fags won't help.
No, they don't actually. You know, I mean, I'm trying to reduce them as much as possible, and hopefully, you know, come off them. But it makes it very difficult.
Okay, excellent.
Right, thank you very much, Dr. Yusuf.
My pleasure.
Thank you.
Bye.
See you.